SmashweRx, welcome back over at CrossFit Brentwood. We're going to go over some stuff. I had a guy named Adam send me a message on Instagram about how he's getting some referred pain, some tingling down behind the knee, all the way down into the calf and sometimes into the foot, and a lot of stuff with the Gracilis and the Adductor group. There's 3 in here, so I'm going to explain how you can smash those out and how a lot of times, like Adam was saying, he doesn't have any nerve issues. He's gotten an MRI, no discopathy, no radicular problems because there's no decay in the spine. There's nothing going on there, so now we're looking for this needle in a haystack. Well, I just found it. So we're going to go through how to mobilize this. A lot of times you have these 3 adductors in here, and when we drop into the bottom of a squat, when we get into that squat, notice how my knees go wide. Well, when I'm in this position, I'm firing my adductors to help drive myself out of the hole, while everything we do in CrossFit pretty much is a squat. So the adducter brevis, the adductor longus, and the adductor magnus, they all work together with the gracilis in here, and then also in the back, there's the semitendinosus and the semimembranosus coming here. So they interdigitate. Big fancy word, basically means they mesh together. So if one's stuck, they're all stuck. But the problem is there's 2 adductors up here, the brevis and the longus. They're going to refer pain down in behind the knee and down into the calf, and they can even give you a little tingle in the foot. If you watch one of my videos about referred pain into the hand from the T4 area, the subscap and all that stuff, this is the same, along the same lines. So I'm going to show you how to smash that out. Super awesome, super painful, so we're going to get your smash on. By the way, we've got Mike behind us doing all the filming. He's a superstar stud. He did Diana with me today, and we crushed it. That's why we're a big sweaty mess. So you're going to take a kettlebell, put it on its side. I'm going to give you a little advice. Don't do it like this. This has got pain written all over it. You want to stay out of the pain kick. So we're going to take the kettlebell, we're going to put it on its side. This is a 35, so you want a pretty wide kettlebell so you can get into that area. And just so you have an idea, this is that inguinal crease, okay? So we want to get, so I'm going to put my leg up here. We want to get in this area right here, okay? There's a big fat meaty spot right here that runs down along the inside. That's that gracilis. We want to stay just above that and right along the edge of that gracilis, and we're going to stay really high on this one. So all you're going to do is you're going to get on the kettlebell. You're going to get your leg really wide, and you're going to find that spot, and trust me, you'll know when you find it because it hurts. And you're just going to, yeah, like right there. So if you'll notice, just to let you know, Adam, I have the same kind of problem. It friggin' hurts. And what I want you to do is you're just going to bring your leg back and forth, real small ranges of motion. And you're going to grind, so when you're doing this, it's almost like you're trying to kickstart a Harley. You're just going to push away, and you're really going to peel away. So if you look at me, I'm actually coming up and bringing myself up to try and grind away on that tissue, and then you're going to work your way all the way down. The reason I have you using a bigger kettlebell is because it's a bigger contact. Now, you can add to this when you have a cool friend like Mike, and he's going to put a little weight on here. Now, if you can see his foot, I'm going to have him bring his foot up just a little bit higher. So he's got his foot on there. This is gnarly hard, and then we're going to do the same thing. We're going to come all the way through that. Like that is just diabolical. All right, so he's going to come off me because I'm about ready to pass out. So that's number 1. That's going to hit, and you're going to work this entire area, and you're going to come back and forth. Now here's the problem. You have this gracilis here, which gets injured a lot in a lot of the jumping, rapid movements, repetitive use, all the stuff we do with CrossFit. So I'm going to show you how to trap it with a peanut. So you take the peanut, and I'm going to show you on the box, but where that peanut's going to go is it's going to go right on the inside here. So it's trapping both the gracilis and that semitendinosus. You're going to come all the way up. The ischial tuberosity is right up in here. So it's basically the sit bone. Yep, it's right up by your butt. You got it. So you're going to come all the way in here, and you're going to work all the way down this line, but you're going to do it with some weight. So you're going to get a box that's higher. It allows you to kick out your leg. And you're going to take a 45. Now, if you guys watched my video with Jay Gray and Blackwell, Rob from the LA Rain, you'll know that I sniped him into a video, and I put him through a whole lot of hurt with immobilizing this. So you're going to take the peanut, and you're going to start really high. And if you look, I already have the 45 on here. This way is pretty forgiving. This way, so much worse. And I'm going to rotate myself out. That's why I want to be able to put my foot here. So I'm all the way out like this. I've got that entire group trapped in here, and I'm just going to grind back and forth over and over again. You're going to do this until you feel that change, and I promise you this will be a hot spot. You're going to go all the way back and forth. All you're going to do is you're going to move down that line. Now for Adam, just to give you an idea, and know I keep talking about Adam, but seriously, he's got issues we're gonna help him with. You're gonna start a lot lower, and you're gonna make sure your leg is really close. This is already painful just by doing this. So be really careful, because I'm right where that myotendinous junction is, so where the muscle joins the tendon. So you wanna really be careful in there, but go ahead and smash that out. If you can handle it, get that 45 on there. If you notice, I'm trapping both bellies of that muscle, and I'm just going in and out. And what I'm doing is I'm peeling those tissues apart so they can slide past each other and let that fascia work the way it's supposed to, so it acts like that slippery paper between the muscles. Now, just so you know, Mike knows exactly what I'm talking about because he studied lots of EMT, I think, right?
Correct.
So, yeah, so he's an EMT, so he understands this stuff. So that's number 2. So actually, we got 3. We got this one by yourself. We've got the one where you got a superstar like Mike that stands on you. Then we've got the one with the 45. We're gonna trap all this all the way down. Just avoid going behind the knee, because behind here is a neurovascular bundle. There's a lot of stuff back here. Mike knows what I'm talking about. There's a lot of stuff back here. You don't want to smash away on that. Now I have a sleeve on, so we're gonna pop this off really quick. You're gonna take a voodoo band. Most people use a voodoo floss for trapping a joint. I'm gonna have you do it in this area instead. You can do it really high too, but we're gonna start really low just for the sake of Adam. So we're gonna come up, we're gonna take that floss, we're gonna get all this tissue. Now the tightest portion of what we're doing is gonna be around that belly of the muscle that's really, really sore. We're just gonna take this and then looser on the outside of the quad. And then again, real tight up in here, the belly, you can see, getting pretty tight. So what we're gonna do, we're gonna take that. I'm gonna take my thumb, shove it underneath the voodoo band so you can see that. The reason I put my thumb under there is so I can bring it all the way around and just tuck it underneath. Super easy. So now I've got this tissue all trapped. Now check this out. You need to make sure it's a really high box. You're gonna bring your leg up and you're gonna bring it all the way out. Now this is where you're gonna have a little bit of balance. You're gonna bring your leg all the way out like this, turn in, turn out, bring it all the way up. So what I'm doing is I'm engaging all these tissues in here. You're gonna bring it all the way out, all the way in. Now this one here too, you can really rotate forward. If you rotate forward like this, it's gonna peel away that structure in here, that gracilis, that adductor magnus, that semimembranosus and that semitendinosus are all gonna get peeled away in here. Remember, there's something in here called the pes anstream. It's where all those muscles insert down here on the tibia. So you can go ahead and get on that too. You just voodoo floss the bottom half instead. Just don't capture the patella. So same thing, we're gonna come in, we're gonna come out. Go ahead and go wide too, give it a real good push. Really, really kind of smash out that tissue. Make sure you're going through full ranges of motion. Remember, voodoo floss only works when you move, right? So you don't wear these things to do lifts. You wear these things to floss out tissue. Go ahead and unwrap it because, well, it does cut off some blood flow. And with this, 3 minutes is about the rule with that. Now the last one is, you're gonna take this. You can use a kettlebell or a 45. God, this stuff's fun, isn't it? Mike's switching hands back and forth because the camera's getting really heavy. We did Diane with like 8,000 pounds today. So we're gonna take the leg, we're gonna drop it out like this. You're gonna take that lacrosse ball, you're gonna roll this. Oh God, that's so horrible. And you're just gonna roll it all the way across. And all I'm gonna do is I'm gonna lift slightly and back down. And if you really want to, that's pretty precise, take that off. Get that lacrosse ball, lay back, or get the lacrosse ball out, take the 45, and just grind away on that high portion of that gracilis, and that high portion of that, adductor longus and brevis. Grind away. You're gonna work your way all the way down. Now if it's too much and you have to stay up like this, roll a little bit away so you can flatten out that leg. I want that tissue to be able to get captured by this, this plate, so you can just grind away on it. Hang out here, and just smash this away until you feel a change. Remember what I said, change happens when change happens. Isn't that profound? It's like philosophy, SmashweRx. Hey listen, that's how you mobilize all this. That's how you're gonna get rid of a lot of that tingling and that referred pain down into the bottom of the leg. It's not a disc, it's usually some tissue that's trapped up. This is Trev from SmashweRx, Mike behind the camera. I'll see you guys tomorrow.